New data released by the CDC shows an alarming nutrition reality for many kids and teens. While overall, we're eating less ultra-processed foods, they still make up more than 50% of the total calories we consume, a number that's even higher for children 18 years old and younger. To help us understand what this means, I'm joined by CBS News medical contributor Dr. Céline Gounder. Thank you so much for taking the time today. So what does this study tell us about our consumption of ultra-processed foods?
So the CDC study found that the average American adult gets more than half of their calories from ultra-processed foods, and it's even higher for kids and teens, over 60%. And what are some of the common foods that are driving this? Sandwiches, which actually surprised me.
Yeah, me too.
Baked goods, snacks, and sodas, sugary beverages. So the key thing to get across here is this is not just about looking good and losing weight to fit into that dress. This actually has very real health impacts. So in addition to obesity, type 2 diabetes, high blood pressure, cardiovascular disease, stroke, kidney disease, cancer, the list goes on and on.
Well, and we've had discussions before. You know, I'm going to out myself. I do consume ultra-processed foods in the form of energy drinks. I mean, if we know it's so bad for us, why do so many of us continue to do it?
Look, these are foods that are cheap. They're convenient. You can find them everywhere. And on top of that, they're engineered to be addictive with the salt, sugar, fat, and also certain sensory tricks like how those chips sound or how something smells. And so it's really meant to hijack the part of your brain that craves certain foods.
And I just want to go back to the health piece of what the majority of eating unprocessed foods, because you talked a little bit about some of the things like cardiovascular disease, but dive a little bit more into the weight piece of it.
So there was a recent study out of the UK looking at people who had a diet of ultra-processed foods. It was improved to help them lose weight versus people who were having largely whole foods, homemade foods. And what they found is both groups did lose weight, but the group that was getting the homemade foods lost twice as much. And so what this really tells us is it's not just about the nutrients, because the nutrients, you know, the vitamins, the proteins, the fiber were the same, actually. But it's that the processing itself is driving some of the weight gain.
That's fascinating, because you would think, okay, the nutrients might be different. I'll definitely be thinking about that and trying to do more of this. I mean, look, the obvious, can anything be done here?
Well, the FDA has been considering new labeling guidelines, front of package, that would say low, medium, high for salt, sugar, and fat. So those are the key things you want to be paying attention to. We're also about to be getting new dietary guidance from the USDA as well as HHS. So stay tuned for that this fall. And then big picture, when you yourself are going to the store shopping, focus on whole foods. If the ingredients sound like a chemistry set, it's probably not good for you.
That doesn't sound good for my energy drink addiction, Dr. Gounder. Thank you, even though that's sad news.